Good morning, dear students. Today we are discussing about the practical section class Roots of Drug Administrations. And the previous class we discussed about the sources of drug informations and what are the different sources of drugs. Okay, continuation of that first class. Today's class is based on the roots of drug administrations. All these theory aspects we covered our theory class. So roots of drug administration in our theory class we discussed about the different routes of drug administrations, their advantages and disadvantages. Drugs are available in different forms and they can be administered as parenteral, enteral, and this mainly based on the depends on the conditions and patient situation. Okay, in your record there is some examples are given, some questions are given based on the routes of drug administrations. Give two examples for each of the following routes. First one is the topical route. What's the topical route? Topical route, here is the drugs are administered on skin or mucous membrane. Usually these lotions, ointments, all this comes under this topical applications. Best examples are nitroglycerin ointment, metronidazole ointment. Next question is the examples of oral route. In oral route, most of these capsules, tablets, all this comes under this the oral route as the enteral route, drug administration through GIT. Examples of some capsules are amoxicillin, tetracycline, tablets like aspirin, paracetamol, these are the well-known tablets. Entry coated tablets or capsules. What are the examples of entry coated? First, the peculiarities of this entry coating is a special coating with cellulose phthalate. This is helpful to protect our drug particles before reaching the intestine. Some drug particles, if breakdown occurs, so this results the therapeutic failure. So this entry coating help to avoid the breakdown of this drug particles before reaching the intestine. They only dissolve in the intestinal juice. So this is helpful for the good therapeutic effect of drug. So best examples of entry coated tablets are diclofenac sodium, dual clox, erythromycin tablets. Next categories are parenteral route. Parenteral route is the drug administration other than enteral route. Inhalation route, mostly these volatile gases, oils, liquids, all these administered through inhalation route is the fastest drug administration and this faster drug absorptions are shown. Mostly this suitable in case of administration of general anesthetics. For bronchial asthma, salbutamol is most effective. Injections categories, the best examples of intradermal route. Intradermal, that is drugs are administered on the outer layers of our skin, that is intradermal. Mostly this intradermal route is suitable for this vaccine administration. Subcutaneous, that is drugs are here administered or injected into the subcutaneous tissues. Best examples are insulin and testosterone. Intramuscular, here drugs are injected into large skeletal muscle. Mostly this antibiotics like penicillin, analgesics like this morphine is the best examples. Intravenous route, mostly this antibiotics, diazepam. Intrathecal, that is here the drugs are administered into subarachnoid space of spinal cord. Mostly these spinal anesthetics are preferred route. Another example is amphotersins, an antifungal drug is intrathecally administered for fungal meningitis. Transdermal, there is a nitroglycerin and estradiol. Transdermal, here drugs are administered into transdermal patches. And through these patches, drugs are slowly released to our skin. Sublingual, that is drugs are administered beneath the tongue. What are the best examples? Sorbitol, nitroglycerin and nifedipine. Rectal administrations, these drugs are injected into rectum. That's the mostly diazepam, aminophylline is the best examples. Next we come to this, the enumerate 4 new drug delivery system. There are lots of drug delivery systems are available. These are helpful or overcome the existing dosage or drug delivery systems, side effects, and better bioavailability. These are the some examples: prodrugs, liposomes, progesterone, and occursurge. Prodrugs, basically these products are pharmacologically inert one, is an inactive one. But when this undergoes biotransformation or any enzymatic cleavage occurs, this forms the active compound, and that active compound shows the pharmacological action. That is the prodrugs. What's the importance of these prodrugs? Is comparing to the existing dosage form, these prodrugs are better bioavailability and targeted delivery. If drugs are targetedly delivered, that means these drugs are released in the controlled manner, so this is helpful to minimizing the side effects. And drugs also have the prolonged duration of action. For examples like this, bacambacillin is a prodrug of ampicillin as a better absorbed, and so this prodrug shows the less side effects like this diarrhea comparing to ampicillin, and this also helpful to prolonging the duration of drug action, and at the same time these prodrugs are minimizing the side effects. Another important newer drug delivery are the liposomes. These liposomal drug delivery systems are usually act as the carrier. This act as the carrier for the delivery of some of these anti-cancer drugs and anti-HIV drugs. So this act as the carrier for the delivery of drug system. Another examples are the progesterone. This is the progesterone releasing intrauterine device. This mainly used for the fertility control. Occursurge is the best known ophthalmic drug delivery system. These are inserted in our eyelid just like contact lens. Best example is pilocarpine. This usually delivered mainly used for this treatment of glaucoma, and this existing ophthalmic preparations like eye drops. This shows the main advantages like for this existing eye drops are usually administrations you record this 3 to 4 daily installations, and sometimes shows the eye irritations, and these drawbacks we can overcome with occursurge. And another important one is also drugs are released in the controlled manner, so this help to minimize the side effects of the drugs. Okay, thank you.